all of you. 1/3 of the world population is the carrier of this deadly pathogen. 2 million deaths every year, roughly 1 in every 20 seconds. Millions of multi-drug resistant cases are reported every year. Arsenal to fight this disease is very weak, and antibiotic resistance is a serious threat to global health security because it impacts global trade and travel. Many people infected with the disease are resistant to first-line drugs, so doctors are forced to move those patients to second-line drugs, which turn out to be more expensive, and in some cases it is 6 times costlier than the first-line drugs. So fighting this disease is not only going to be difficult but also very expensive. The most disheartening things about this infection is that it is found in the age group of 20 to 40 years, and this is the most productive age group of any country or nation. So it is directly going to affect the economy of the country or nation. This pathogen poses hydrophobic cell envelope, drug modifying enzymes, and undergo mutations. Apart from this, there are other reasons for the development of multi-drug resistant cases, and it has to do with the attitude of the people. And this problem is more serious in India because of poor civic sense. Sneezing and spitting in public places is very common, and this also contributes to transmission of this infection. And the most important reasons for the multi-drug resistant cases is the irrational use of antibiotics. Antibiotics are available over the counter, and people, they buy and don't complete the full dosage of the antibiotics. And plus spurious drugs, they do not contain full doses, and this gives microbes time to develop resistance. And also doctors are under tremendous pressure from pharmaceutical companies to prescribe their product, and they don't want to lose their business also. So they prescribe antibiotics even when it is not needed. This bacteria is biosafety level 3 pathogen. It remains dormant and is very difficult to culture. Antibiotics research is under-researched in Asia. There is a need to expand research. Systems biology and graph theoretic approaches are increasingly proving to be useful in overcoming the inadequacies of the conventional drug targeting, which focuses only one molecule at a time, while systems biology and graph theoretic approaches helps in understanding the complex biological systems at the systems level. It helps in understanding the structure of the system, the dynamics of the systems, and based on that we can design and control the system. Yes, we can control this tuberculosis. Graph theory is a game changer in understanding the complex metabolic network of this deadly pathogen. When mycobacterial protein network is represented as a graph, then it becomes amenable to various mathematical and statistical analysis. Graphs and networks are abstract representation of more complex biological processes. There is a reduction in complexity. The best part of this graph modeling is that we can construct the urgency matrix, the urgency list, the cycle matrix, the path matrix. We can do the shortest path analysis, we can do alternate path analysis, we can do path redundancy analysis, and also we can do the degree centrality analysis. Also we can find the protein hub, and this hub is the strategic point which is connected to maximum number of proteins on the network. If this hub is targeted, then the cellular integrity and the robustness of the mycobacterial protein network will be compromised. So the need of the hour is to think out of the box and to find the novel intervention strategies against this deadly pathogen.